10 important blood tests you should know. Blood tests are a crucial diagnostic tool that helps doctors assess your overall health and detect underlying diseases early. Here are 10 common and essential blood tests for adults. 1. Complete blood count (CBC). A CBC test provides detailed information about the main components of your blood, including red blood cells, white blood cells, and platelets. This test allows for assessment of red blood cell count. Reflects the blood's ability to carry oxygen. 1. Complete blood count (CBC). Hematocrit, the percentage of red blood cells in the blood, indicating blood volume. Hemoglobin, a protein in red blood cells that carries oxygen. White blood cell count reflects the body's resistance to infection. Platelet count helps with blood clotting and wound healing. 1. Complete blood count (CBC). Abnormal CBC results can indicate health issues such as anemia due to iron, vitamin B12, folate deficiencies, bone marrow diseases, etc. Infection, bacterial, viral, fungal, etc. Inflammation, infection or tissue damage. Cancerous diseases such as leukemia, lymphoma. 1. Complete blood count (CBC). Bleeding disorders due to platelet deficiency or clotting factor deficiencies. 2. Blood chemistry tests. Blood chemistry tests measure the levels of various chemicals in your blood, providing information about liver, kidney, thyroid, cardiovascular function, blood sugar, and many other factors. Some common blood chemistry tests include 2. Blood chemistry tests. Blood glucose checks the amount of sugar in your blood, assessing your risk for diabetes. Creatinine assesses kidney function. Gestalt evaluates liver function. Cholesterol checks cholesterol levels in your blood, assessing your risk for cardiovascular diseases. 2. Blood chemistry tests. Total protein checks the total amount of protein in your blood, reflecting your nutritional status and overall health. 3. Thyroid function tests. This test measures the levels of thyroid hormones in your blood, helping to detect thyroid problems like hyperthyroidism or hypothyroidism. 4. Lipid panel. This test measures the levels of cholesterol and triglycerides in your blood, helping to assess your risk for cardiovascular diseases. 5. Creactive protein (CRP) test. The CRP test helps assess the level of inflammation in your body. Elevated CRP levels can be a sign of acute infection, cardiovascular disease, cancer, or other chronic inflammatory conditions. 6. Sex hormone tests. This test measures the levels of sex hormones such as estrogen, progesterone, testosterone, etc., helping to diagnose reproductive problems, hormonal imbalances, and assess fertility. 7. Urinalysis. Urinalysis checks the components of your urine, such as glucose, protein, blood, white blood cells, etc., providing information about kidney function, urinary tract infections, diabetes, and other health issues. 8. Serology tests. Serology tests help detect antibodies and antigens in your blood, aiding in the diagnosis of infections, autoimmune diseases, and other conditions. 9. Thyroid antibodies. Anti-TPO, anti-TG. This test helps detect antibodies against the thyroid gland, which are a sign of Hashimoto's disease, an autoimmune disease affecting the thyroid. 10. Genetic testing. Genetic testing can detect gene mutations associated with disease risk, helping predict and prevent serious medical conditions. Note: depending on the type of blood test and the laboratory, the turnaround time for results may vary. Consult with your doctor to choose the appropriate blood tests for your health status. Regularly getting blood tests can help monitor your health and detect potential diseases early.